Welcome. I'm Lee Doherty Biddison.
And I'm Carolyn Cumsty Fowler, and we are your co-hosts for the Johns Hopkins Medicine Office of Wellbeing's podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare.
We spend a lot of time thinking about how to influence workplace well-being in healthcare, and we're excited to share some of what we're learning.
Thank you for joining us.
Hello and welcome. My name is Lee Doherty Biddison, and I'm here as your host for the Johns Hopkins Medicine Office of Wellbeing podcast. It's a pleasure to welcome you to our first episode. And today I have the pleasure of welcoming Dr. Elizabeth Harry, Chief Wellness Officer for Michigan Medicine. Liz comes to us with a wealth of expertise from her leadership opportunities and work and well-being at the Brigham and Women's Hospital and at UC Health in Denver, Colorado. And now she is in this wonderful leadership role, much deserved, at the University of Michigan. So welcome, Liz.
Thank you. I'm so excited to be your first guest. This is really fun.
We're thrilled that you're here. So tell us a little bit about your journey to becoming Chief Wellness Officer at Michigan.
Yeah. It's a little bit circuitous. I'll try to tell the short version, but I never particularly meant to go into well-being. I was originally actually very interested in quality improvement and trained in quality improvement. And when I was an early faculty member, we did a really large quality improvement project in a couple of our units and saw really great clinical outcomes. And yet our clinical care team didn't love it. And that's not to say all members of the care team didn't love it. A lot of members loved it because they were getting information they had never really gotten as easily before. We did these interdisciplinary bedside rounds, but our physicians really didn't love it. And I didn't understand why. So I asked them, this has all this great patient data. Why don't you like it? This is stuff that we say we all care about, and we're improving the experience for our patients and we're improving team communication. And they said, it's not really about this intervention. It's not this specific intervention that's the problem. It's just change. It's just another intervention. It's another thing that I have to figure out to do differently. And I was so fascinated by this. And that was in 2013, roughly. So pre-COVID, pre all the change
Right.
we've all had recently. So I started researching change fatigue and just trying to learn about the concept. That led me to the concept of cognitive load. I then moved to Boston with my husband for his training. And when I was there, started really looking into this concept of cognitive load and got a small grant to study some of it. And one of the outcomes that we looked at was the relationship between cognitive load and burnout, and particularly in post-hospital discharge settings. And so as I was engaging in more and more of these conversations, more of the well-being piece just kept coming up. And
Wow.
so then I found myself in this well-being leadership role and that well-being leadership role. And I really loved it. And I got to the place where I really felt like, we have some of the most committed and dedicated people on the planet in healthcare.
Absolutely.
And they're really suffering and we can do better by them. And so it's become now sort of, this mission, this really strongly driven mission to try to make things better so that people want to continue to have that commitment and drive to be part of our field.
That's wonderful. Tell me a little bit about, looking back, what are some of the things you would have told yourself or coached yourself 10 years later so that you described starting and, this sort of on this journey in 2013? What are the, maybe some of the things you wish you knew or how you would have coached yourself then,
Yeah.
knowing where you are now?
It's such a good question. I think one of the things that I would have coached myself on, and I actually just got to hear a coach talking about this recently, is this idea of development. And he sort of used the metaphor of pruning and how you prune trees, sometimes really make them look not great while you're pruning them, but to have these beautiful, have them with beautiful flowers or beautiful fruit or whatever you're trying to grow later. And I think this idea of when things don't go well, if this project isn't well received or, you don't get that grant or you don't get that position or whatever, that it's all sort of pruning for something bigger that can happen later and not to worry about that piece so much.
It's a helpful reframe when to think about what might be down the road as you sort of struggle through feeling like, "Ooh, this didn't turn out like I wanted."
Yeah, yeah, and how many of those things have we all tried, right? Where you tried something, you had this idea or you tried this initiative and it didn't work, or people didn't love it, or it didn't go exactly as planned. And I think the other piece that really ties into this is this idea of growth mindset, which I know, people are very familiar with now, but I think, my kids come home with talking about growth mindset. So I think we've done a good job, getting it into the culture, but I think this idea still, we don't hold each other accountable with a growth mindset a lot of times. We look at our health systems, if they try something and we'll say that was a failure, and it's like, but that's not really a growth mindset, is it? Maybe we want to look at that and say, it's not where we want it to be yet. And how do we continue to iterate around it? And how do we learn? And how do we be curious together and grow? You asked about um, how I ended up at Michigan. And that was really one of the things that drew me there was um, this this area where there are so many people studying so many different disciplines right next to each other, working in this really collaborative way to be curious about things together. And I think this sort of burnout issue is in the water in healthcare right now, right? It's
Right.
everywhere. But the way we're going to solve it is by coming together as teams and treating it like an intellectual problem, not sort of a who's doing what wrong or who's hurting me or, kind of an us versus them thing, but really how can we solve this from a really intellectual
Right.
standpoint and how can we lean on those from other industries that can help us think about it with fresh eyes and different eyes than we might have being inculcated in the systems that we've trained in.
For sure. Culture dies hard, right?
Yes.
Yeah.
Yeah.
So I love this idea of a collective growth mindset. I'm so with you on this. We're getting there's definitely some traction in the space of on an individual basis,
Yeah.
trying to learn to be a little bit more self-compassionate. There's a
Yeah.
lot of that in the burnout literature,
Yeah.
thinking about that. And of course, so much of Carol Dweck's amazing work.
Mm.
But shifting from an individual growth mindset to a collective growth
Yeah.
mindset so that systems and organizations take on that same approach
Yeah.
is I think it makes a ton of sense for where we need to go.
Yeah.
Do you have ideas for how to get there?
I think it's hard because I think that, we're in a tough time where there's a lot of division. And I think there's a lot of othering happening in the healthcare spaces I see around the country. And it doesn't matter what groups you want to look at. You could look at by discipline, by specialty. You could look at people that are providing clinical care every day or people that are doing administrative work, or you could look at insurance companies or lobbyists. Like, it
Right.
doesn't matter how you cut it. There's a lot of ways that we sort of other groups of people and then assign blame a little bit. And I think this idea of assuming positive intent is really important.
Huge.
And how do we try to realign around our common why and really believing that we're aligned around that common why, I think is probably one of the first steps. Um, and I think asking ourselves why we want to believe that this other group is responsible for our pain or responsible for whatever it is we're upset about at the moment. How is that helping us in the moment? Like, why are we choosing to frame it that way? And because it's serving a purpose, or we wouldn't be doing it. And so
Right.
really trying to understand what purpose that's serving.
Challenge ourselves in that space.
Yeah.
Absolutely. Um, Liz, I'd love having these conversations with you because I think it could go so many different directions. But I'm going to try to stay on track with what we said we would talk about. But this is I have a lot to think about already with the collective growth mindset. So tell us a little bit more about how you developed this specific interest in cognitive load and human factors as relates to well-being. You mentioned sort of the early phases of it, and to describe for us how that's grown over time. And
Yeah. I mean, so I was so interested in this idea that our brains have a limited capacity to process information, and that's not going to change in a very meaningful way. And yet, the data coming at us is changing in a very meaningful way, moment by moment.
right,
And we don't operate as if our brain has a limited capacity a lot of times. And sort of the expectation is I can just process all of this. Let's add all the wearable data to the EHR and I will also process all of that, right? And there is sort of a time at which you just can't. And we have to think about when do we have to change the way we're presenting the data to make sure it's the signal that's getting attention and not all the noise. And I think what I found really interesting as I went through my career from training to early faculty to sort of, mid-career faculty was that sort of far away look you see on people's eyes when they're overloaded. You know how you can kind of look at someone and say they're not here, like they're not totally with this conversation we're having. And I feel like I used to see that, in the intern's eyes at the end of the day. But other people on the team would be doing okay, and if you were doing teaching, they were kind of with you. And then it sort of was a whole, learning team, GME, the interns and the residents, they all
Yeah.
look that way. And then it got to the point where I felt like my colleagues looked that way at the end of the day too, right? And it was sort of everybody looked that way.
And then you look in the mirror and you're like, oh, hey, I look that way.
That way. I am not paying attention anymore. And so I I I I started getting a little bit concerned that if we continued the way that we're going without pausing and saying, has the complexity of our system outpaced our brain's ability to cope with it? And at what point do we need to kind of change the way we're presenting things and reevaluate it? And there's so many industries that think about how to do this on a regular basis. And when do we need to start leaning into those industries more so that we don't miss things, or so that we can be more present with patients, or so that when we go home, we're present with our family and we're not burning ourselves out in that way by harming those relationships. So I think um, it was just sort of through observing all that, to your point, in other people and myself over the course of my career, and really feeling like it's probably time to pivot a little bit.
I just in thinking about, sort of what's prevalent in the headlines today. AI obviously is all over the place,
Yeah.
right? And I'm just wondering sort of what your thoughts are on how AI is, and both now and in the future, is going to impact this challenge of
Yeah.
cognitive load or cognitive overload,
Yeah.
and what are the approaches that we need to take to leverage the power of it
Yeah.
without being totally overwhelmed by it.
Yeah, I think it's a great question. And I think the key piece is and comes down to the idea that it's not the technology, it's how we use the technology. And I think this is true for everything, right? So it's smartphones didn't sort of ruin everything, right? But it very much depends on how you use your smartphone and what do you use it for and what do you spend time on it doing. Similarly, I think how we use AI is going to be really important. And there's a great paper that makes recommendations from human factors literature on how we should think about testing our AI models from a cognitive load perspective to make sure that they're actually reducing cognitive load in the way they're delivering information. I think they can be built in a way that it helps summarize a massive chart in a way that we show can be accurate and it's not hallucinating, and it is reliable and safe to use, and all those things are really important that those are studied, and that's true, but that it could then ultimately really help with pulling that signal from the noise so that then we use our brain and our attention for deciding and using medical decision making around what to do with that signal rather than trying to find the signal, which is a lot of what we spend our time doing now in addition to the medical decision making. So I think that could be really helpful. But I do worry about sheer volume. People are just creating tons of content with AI right now and flooding the internet with it. And so there's this issue of increasing the noise, if you will, and increasing things that are not accurate, that are in information space, and it just gives us more to sort of filter through. And so I think, again, I think it's just really depends on how we use it.
I think one of the questions you and I spoke earlier before we got online, about some of these AI driven resources for generating notes in the electronic medical record.
Mhm.
And I think our collective institutions are exploring those. They're cutting edge. We should be.
Mhm.
I'm curious what your thoughts are about what the questions we who are interested in well-being, what are the questions we should be asking as we pilot those softwares? Like, what should I be talking to my CMIO about
Yeah,
in
yeah.
that space?
It's a really good question. I mean, I think we want to make sure that the measures that we know we're already looking at, right? That um, the AMA has helped us with, and folks at Epic around, how much time are people spending in their in basket, and how much time are they spending outside of work in the EHR, and how many people are helping put orders in, or how many people are touching an in basket message when it gets passed around. making sure that those are being meaningfully impacted by
Right.
this work, that we can show that we are impacting things that we know are good measures of sort of our electronic experience. I think this piece around accuracy and not hallucinating and having the ability to check the original record, if you will, so
Mhm.
check the audio or be able to reference back to the source of truth is going to be really important to ease people's concerns as we start this, because I think we all hold ourselves to really high standards when we're delivering clinical care and understand the consequences of something that might be misdocumented. And there's going to be some free floating anxiety around that. And so I suspect for a while, people will be doing a lot of double work, where they
Right.
use it, but they're also doing their old workflows because they don't quite trust it. And we want to help them get away from that double work. That's just extra cognitive load, but they're not going to do it if they don't feel really safe that there's,
Confident in the
yeah, that
technology.
they're confident and they know they can go back and check if
Right.
there's ever a question.
Yeah, I think that's huge. It's such an important part of all of this. Well, so let me ask you this. You were the first person, I think, who was able to get my attention enough to convince me that we live in in an attention economy now.
Yeah. Yeah.
This was a talk you gave.
Yeah.
Gosh, not that maybe 6 months ago now, but I remember listening to you talking about that, and I was like, wow. And probably you've been talking about this to me maybe for years. I don't know, but just couldn't get my attention. Um, but was so convinced about that, just in listening to you share about that. So I wonder if you'd talk about that a little bit,
Yeah.
and then I have a follow-on question for
Yeah,
you.
no, absolutely. Well, I stumbled across this while I was continuing to build talks on cognitive load and a lot of what we think about when we think about cognitive load is where we're placing our attention because there's more data than we can attend to and process. And so we have to be very intentional about where we're placing our attention. And so then I got sort of curious about where do we place our attention and why is that important? And the more reading that I did on it and just learning about this concept of an attention economy and thinking about what does that mean? And so you have to kind of break it down, right? So attention is the ability to focus your awareness on something. And an economy is the study of scarce resources and how they're moved. And I had to look that up because I'm a doctor and I'm not an economist. but um, what I think is very interesting, first I'll just say sometimes it's called an information economy, which is clearly inaccurate when you look at the definitions, right? Because information isn't scarce. It's our attention that's scarce. In fact,
Right.
we have too much information. So there's this idea that you have a scarce resource, it's limited, and it's valuable. It's inherently valuable and it is being valued. People are placing value on it. It is being monetized. And so we know that from social media, right? And there's lots of documentaries out there talking about this. But it is a monetized commodity, which brings it into the space of economics. Um, and there have been theoretical physicists that have actually said that we are moving to, that we were going to move to an attention economy a long time ago, and away from one of goods and services. Obviously, we still buy and sell goods and services, but largely what's being bought and sold is our attention. And I think a lot of times people talk about time as your most valuable asset. I was actually talking to someone about this the other day, and he was saying, how important time is and making sure you have that time with your family. And I was thinking, this is why thinking about an attention economy is so important because you could spend time with people and not pay any attention, be checked out or be in your head,
Been there.
right? And
Yeah.
then it's not valuable time. It isn't something that contributes to the relationships or contributes to making memories with these people or something that you're going to feel good about later, likely. And so I think this concept of what is our most valuable asset? And I would argue that it's our attention. It's not our time. A lot of people say it's our time, but I don't think it is. I think it's our attention. And we have spent a lot of resources investing in the brains of people that deliver healthcare. And so that they can use that knowledge and their attention to understand a problem and help think about how to effectively solve it in a way that is compassionate and connects with our patients. But they can't do any of that if they don't have attention to do it. It doesn't matter how much information is in their brain. So I worry about healthcare systems where we're dividing people's attention or we're drawing their attention away so often that despite this being our most valuable asset, we're not really treating it as such.
Gosh, it's so important. The all the lessons that we've learned about not multitasking, but task switching and the degradation of attention and the impact on all the outcomes that we care about. Our patients, our relationships, all of those things I think so important. So as we wrap up, give us like one or two of your personal tips for managing attention.
Yeah. So as we were talking about earlier, I don't have this nailed, right? I like everybody get down rabbit holes with my attention too. I am someone who likes technology. So I have an app on my phone that sort of locks down kind of attention sucking apps. I won't name names, but right, like it'll lock down certain apps for me at either time I've spent on them or different times of day when I know that don't want to be spending time on those apps. So I find that really helpful in sort of removing some of that temptation. I do think a lot about standardization, both in how I do things in my day to day, how my family does things, what we have for dinner, when we have what routines around, getting different chores done. Personally, both my husband and I really try to have some focused attention time with the kids and be very aware of this idea of spending, we call it mommy me or daddy me time with the kids, but spending time that we say to them, this is your time. You have my undivided attention and giving them that time and same for us, and I think that piece is really important. And then in the work world, you probably know this, I'm not great at answering email. And part of it is I've intentionally decided that's not where I want to spend a lot of my attention. I love talking to people. I love spending time with them and learning from them. And I feel like I could spend all day in my email and then I wouldn't really get to talk to anybody. So, sometimes I've intentionally chosen to be, let's say, less responsive in one way to preserve my attention for interacting in another way.
I love it. I love it. Well, I'm going to wrap us up here, closing our time with Dr. Elizabeth Harry, Chief Wellness Officer from Michigan Medicine. Thank you so much.
Thank you so much. This was really fun.
So that's it for today. If you enjoyed what you heard, please share this podcast with a colleague. And as always, we welcome your feedback.
If there are any topics you'd like to hear about, please email your ideas to us at owb@jhmi.edu.